Good day, Dr. Huda. I'm going to present for our group project topic, BCDS, Breast Cancer Diagnosis System. So for our case study, we found out that breast cancer is the most common cancer in women in most parts of the world. So in 2000, there were 1 million cases reported with 372,000 deaths from breast cancer worldwide. Statistics from the National Cancer Institute have shown that every 3 minutes, one woman is diagnosed with breast cancer in US, and every 11 minutes, one woman dies from breast cancer, also in US. So for the case in Malaysia, breast cancer in Malaysia women consists of 30% out of the others cancer in 2002. In 2003, there's 1% increase in the percentage of breast cancer amongst other cancer. This is the source from the National Cancer Registry report. As for the problem statement, diagnosis is breast cancer involve a few stages. From the general medical ward done by clinician, and those reports we're gonna send to radiologists and be followed up by radiologists, and the next department will be histopathology by the pathologist, and the last department is at oncologist by oncologists just to diagnose breast cancer. It's a very complex and time-consuming procedure. So we found that there is a lack of standardized description and categorizations of breast assessments of patients, and this has led to the realization of an urgent need to develop a certain standard form of guideline or system. As for the scope of our project, this expert system BCDS that we developed is designed based on knowledge and experience of doctors from HUCAM only. And this expert system does not include knowledge and medical diagnosis practice done by other medical institutes. And for our objective, in general, the goal is to develop a breast cancer diagnosis expert system based on expert knowledge and experience to assist general doctors in diagnosing of breast cancer. And also we hope that this expert system will make the diagnosis process much more efficient. The system architecture for breast cancer diagnosis system is illustrated in this diagram, where first the doctors will gonna interact with the user interface of our system by keying the facts of the patients, like the symptoms and others, images, knowledge to the inference engine, and the inference engines will generate result by interacting with our knowledge base, where this knowledge base gonna store all the if-then rules and also the facts about the patients. If the users, the doctors, have any questions, they can use the explanation facility provided by asking questions, and explanation will be given to the doctors. For our domain is diagnosis system of breast cancer from 4 different experts, and our knowledge resource is from the UCAM master students, where they already done the projects, the same topic, breast cancer diagnosis system previously, and also the experts from HUKM, Dr. Rina, some journals and medical publication from WHO. Our knowledge acquisition technique is by using decision table and decision tree. And knowledge representation techniques is a rule-based system. Our inference engine we use forward chaining, and as for the explanation facility is going to explain on the relation between the symptoms and the diagnosis result, and also the diagnosis result with the recommended treatment. And the development method we use prototype, and the tool we use in this system is Eclipse and Jest. This is the examples of the decision tree that we have developed and the decision table. Okay, let's take a look at our system. Okay, this is a login page for BCDS. Doctors have to key in their ID and password. After they log in into our system, they can choose the departments to diagnose breast cancer. For example, general medical ward, clinical breast examination, radiology, histopathology, and oncology. Descriptions of each department is included in the system, As for general medical ward, is to get the patient's basic information and symptoms. As for clinical breast examination, it's a physical examination done by the clinician to find any lumps or changes in the breast. As for radiology, it's going to evaluate on the mammogram of the patient. Histopathology is a microscopic examination of tissues, and oncology is going to suggest suitable treatment plan for the patient. We go to the first department. Okay. The system, we're gonna ask the user some basic information of the patient, so the user have to key in all the basic informations and the symptoms of the patient. For example, do the patient have personal history of invasive breast cancer? So after they answer all the questions in the system will recommend that what the next step the doctor should carry out. As for this case, doctors are recommended to conduct clinical examination of breast and mammogram for the patient. So we go to clinical breast examination. In clinical breast examination evaluation, the clinicians or the doctors have to conduct clinical breast examination for the patient. If the doctors feel any painless or painful lump of the patient, then they have to answer accordingly. If let's say there are lumps in the breast, so the system is recommend that the doctor has to conduct mammogram for patient. So we go to the next department, radiology. From here, doctors are required to pick the image that are similar to the patient's mammogram. There are 6 types of breast cancer. First one, a masses types of the lumps, calcifications, architectural distortions, vascular calcification, skin thickening, and skin tag. For example, if let's say for masses, it's a lumps in breast that either benign or malignant type. For calcification, it's a small areas of calcium in the breast. So do for the others, explanations of the medical terms is provided in the system. So we go to masses. There are several shapes of masses observed from the mammogram, so the doctors have to pick which one the patient has. So for example, an oval, so the result is the patient's masses is a Briar's 2, so the patient are recommended to take radiology examination every 2 years. For example, if the patient masses is a microlobulated type, so it's a Briar's 3 mass, so we have to send the patient's biopsy to histopathology department to further diagnosis. So we go back to home and we go to histopathology. Okay. In here, there are all the microscopic images of the patient's biopsy. These are all the tissue architecture found in the microscopic image. So the doctors have to choose which types of cell they observe from the HPE image. For example, if it's a fibroid or adenoma type, then it's a benign, so we have to send patient record to oncology department. And explanation of the images is provided in the system, where the tissue architecture for this image are stroma and epithelial proliferation and so on and so forth. So do for the others. Okay. We go back to home and we proceed to oncology department. From here, there are 2 types of masses, either it's a benign type or malignant type. So based on the report from the previous departments, doctors have to select either a benign type or malignant type. If let's say the masses is a benign type, then there are 2 subtypes, either abscess or lump. If let's say it's an abscess, so patients are diagnosed to have breast abscess of type benign, so they have to carry out needle aspiration for the patient. If let's say it's a lump type, there are 2 subtypes for lump, a cyst and solid. If let's say for cyst, then the treatment suggestion is please carry out needle aspiration. As for solid, another question is gonna ask either it's a small than 3 cm tumor or larger than 3 cm. If let's say larger than 3, then they have to carry out excision, that is breast lump removal for the patient. If let's say it's a malignant type, less than 4 cm, then the doctors are suggested to carry out chemotherapy followed by surgery, radiotherapy, and last endocrine for the patient. That's all for our system. Thank you. For the future work, we have tried our best to achieve the objectives, but there are still a lot of weakness in our system, so we would like to suggest for further improvement on the system in the future. So the first weakness of our system is this system only included the common cases of breast cancer, as information received from HUKM was quite limited due to patient privacy issues. And the second weakness is this system has not approved by HUKM, as we only able to meet user from one department, Dr. Rina, a pathologist of HUKM, to verify our system. And this system is not able to keep patient record yet. So, suggestion on future work, we would like to improve the knowledge base of the system by including all kinds of breast cancer, including the rare cases. Also, we hope that we are able to implement this system in HUKM to help the doctors in diagnosing breast cancer. And third suggestion is that we can create a database to keep patient records and able to send patient record to the other departments via the system. Thank you.